Let me give you an example of a child, for instance, of that era. One of our favorite kids, and it's quite relevant because within the last few days, the astronaut, the Mercury 7 astronaut, Scott Carpenter, died. And it reminded me of a young man I took care of whose name was was Jeffrey Carpenter, but he insisted on being called Scott. And he had a brain tumor, and it was a slow grower. They're called astrocytomas. Usually you can get somebody with an astro in remission, and then they don't occur for 10 or 15 years. And you always thought at that point in time, maybe in 10 or 15 years, we'll have a cure for that. We treated him, and at that point we did radiation on an inpatient basis. Nice family, nice kid, just, you know, a great thing. Then one day when we were working, we got word that he was coming in. He was being admitted, and we couldn't, it was about 6 months after we treated him, we couldn't think, why? Why is he being admitted? I mean, not having any idea. And the unit clerk took the phone call, so we didn't ask questions, and all of a sudden we heard the elevator door open and the little bump that when you get off an elevator, because he was in a cart, and we heard a blood-curdling scream, and it was him. And we're thinking, what in the world? Well, he didn't have an astro, he had what's called a glioblastoma. Those are nasty tumors, they grow rapidly, and they make life hard. It had metastasized so far that up and down his spinal cord that you couldn't touch him and it wouldn't hurt him. We had to put kind of a tent over his bed because even walking by him, the breeze created by your body walking by, made him crazy in pain. Anywhere you touched him, he screamed. And unfortunately, because of the pressure in his head, he threw up a lot, so we were always having to go in to help him clean up. And every time we walked in, he'd look at us with his little blue eyes, piercing eyes, and say, "What are you going to do to me?" Because anything we did hurt him. And, you know, in this day and age, thanks to fast forward now, we would put that child on initially whatever medicines, combination of medicines it would take to make him comfortable. Then all we had was Tylenol, and no matter how hard we spoke to his physician or anybody else, nobody would order more. And we'd had a discussion on a very morning where we'd ask his parents, you know, he's probably going to stop breathing, do you want us to resuscitate him? And they hadn't decided, and he coded. His heart stopped, so we were bound by law to resuscitate him. So an ICU nurse, myself, a resident and a medical student went in, and by that time, when something like this happens, you ask parents to leave the room because he was bleeding. And you don't want any parent ever to have that as the last memory of their child. And I was running suction and sucked more blood than you can possibly imagine. And he got his heart rate back, and we had enough blood pressure medicine to maintain his blood pressure in his IV that he lived in 3 more days of agony. And after that, 3 out of the 4 of us went to the nurse's restroom and threw up, because I've never felt less like a nurse in my life. And when I think about that, you know, I was working 8-hour shifts. His parents were there 24/7. They witnessed every minute of his pain and his suffering. And we did nothing. Changed now. And I always said once we finally got some significant changes, if I die tomorrow, I'll be a happy person because I have made some small contribution to that. But kids like Scott and others, I could sit here the rest of the day and give you examples, fed my passion to make a difference.